What's up, you guys? It's your favorite spiritual social worker here. There has been some major news with insurance, and I'm here to share with you. If you don't already know, Alma sent out a message to a lot of its providers. Remember that Spring Health bought out Alma, I want to say at the beginning of May. So they also sent out this message as well. So Aetna has decided that it is going to reduce the rates that it pays therapists on their digital platform Alma, which is now Spring Health. This change is supposed to go in effect, I believe, July 15th. Here are the specific changes that they're going to make. First change is that the rates for sessions that are 53 minutes, which are usually what we deem as an hour session, and sessions that are between the minutes of 37 and 52 at the same rate. So basically, it doesn't matter if you see a client for an hour or 45 minutes, it's going to be the same rate with Aetna. Typically, the rates can differ if you have a more complex client. So if you do an evaluation or management for a more complex client, that would be more. Well, now everything is going to be the same. It doesn't matter if the client is moderate or highly complex. The evaluation appointments, the management appointments, the rates are going to be the same. Also, if you are a doctoral level practitioner clinician, you will now be paid the same rate as a master level practitioner. So, as Alma and Spring have notified their providers, they have let them know that, hey, we don't agree with these changes. And some of them have sent surveys to get clinicians feedback on how the change will impact them. How could this potentially impact you if you are a client? Well, one, you might start to find a lot of your providers who are now refusing to take Aetna. It's not the only insurance plan. So, providers, especially if they're saying, hey, if I see you through this plan, I'm going to get paid less. They can either say, hey, I don't accept Aetna anymore. Or they could say, you know, I'm going to stop taking insurance altogether and just be self-pay. Right now, about 35% of therapists already don't accept insurance, and that number is surely to go up because of all this stuff that's happening. How will this impact providers? Providers are not going to have to make a choice. Can I afford to stay in network and still provide service to my patient? Can I still provide the same level of service to my patient? I'm EMDR trained, and sometimes I can't do no session in 45 minutes. I need the hour or more sometimes. You know, I see a lot of therapists in the different like Facebook groups, and they're the first thing they say is, oh, well, just don't take insurance. We have to fight the system, blah, blah, blah. You have to remember that people have bills to pay. Some providers are on the only income in their household. Like for me, I use some of my private practice income to help pay for my daughter's college. The reason that we go with these platforms because it guarantees us income. A lot of these platforms offer guaranteed payment. So it means that you know you're going to get paid on a certain day at a certain time. If you do things on your own, that's not guaranteed. You may wait way more than 2 weeks or a month or 2 months. Also, a lot of these platforms protect providers from clawback, meaning that I don't have to worry about receiving a letter in the mail saying that, hey, we're not paying for these last 6 months worth of claims and we need their money back. I don't got time for that. So it's a little easier said than done. I think as therapists and providers, we need to understand that people make the choices that they need to make for themselves. If you want to venture off and you want to find a solution that is not working on platforms, do so, but don't shame other therapists, providers that need to do that for their families. If you're a client, ask if your provider takes self-pay and do they have a sliding scale. A lot of times they will work with you as they figure out how they're going to move forward. The reality is that we may start to see more changes like this in the future. Regardless, these type of changes and policies make it hard for the mental health system to be sustainable, and that's going to impact people's mental health.